of a situation that I basically experienced at one of the organizations I worked with when we noticed that there was a significant cluster of asthmatic patients in this particular area. And once we identified and used some data and analysis, it was determined that the patients were being impacted by mold, and that was in these homes, and some of the places where let's just call them the landlords, right, or slumlords, were not necessarily taking care of these properties, which help perpetuate asthma within this particular region. So it's not only just family, it's where you are, it's environment. There's so many factors that can relate to adverse outcomes to our families or our kids or our lives. It's just amazing.
Yeah, that's a whole separate bucket of things, right? So we used to have these conversations about zip code being as important as genetic code when it comes to, health. And so certainly, geographically, there are folks who are at much higher risk for certain things because of the environment that they're in, and not the like community and family environment they're in, but the real built environment that they're in, or buildings that aren't maintained. So things like lead and mold and stuff like that. Yeah. Or the proximity to contaminants in the environment. So, I think in inner cities, exhaust is one of the huge things. When people are near highways or whatever, there's absolutely a ring of respiratory disease around those places where there's just more contamination in the air. So you do see that too. Big geographic variations in diseases.
Yeah, and I know in the technology world, we brought it down to the census block, right? So not only just an address and a zip code, but down to the block level, there's variation when it comes even down to that. So what may be occurring on one block and the contaminants or whatever it is that's impacting health may be completely different 1 to 2 blocks away. So we see that all the time. Socioeconomic side, right? So it's just amazing to know how many factors and variables there are to our healthcare.
Yeah, there's maybe not on topic necessarily, but when we talk, we talk a lot about health disparities and health equity, and I think those are things that you can talk about, like you can observe them, but they're very hard to build tactics and strategies around solving. And in order to do that, not only do you need to have the will and desire and resources to really focus on, like, what does that mean? What does equity in health mean? But then you absolutely need the kind of data you were just talking about, which is, we need to know, like, if there's a block, or several blocks where there are higher incidents of an illness,
right?
For me, that means how do we address that? Like, we either need to find out what's causing it and fix it, or we need to provide, we need to flag the fact that, hey, this patient is from this area and we need to pay more attention to this illness because a lot of people get it where they're from, or whatever the case may be. And I think informing healthcare that way, like looking at whether there's bias, whether there's, bias in prescribing, bias in the way that laboratory tests are designed, like all those things are part of that. But then there's also just really having the technology to be very specific about individuals and environments.
Yeah, it's interesting. It again goes back to the father of public health, right? And the concept of, it could just be 1 or 2 different areas that can cause a pandemic or an outbreak. And it's about getting to that specific, cause. And it's key to have information, because the information can help, solve so many different problems that are out there.
Yeah, absolutely.
Yeah.